Health economics, health systems, and health education in action. How does market economics influence healthcare systems? Healthcare resources are limited, requiring decisions about spending priorities. This is often done through cost-effectiveness analysis, which helps governments decide which treatments and programs provide the greatest health benefit for the cost. Today, millions of people do not access services due to cost. Therefore, it is really important for governments to determine what they can get for a particular budget that can help the most amount of people. For a lot of countries, this includes smoking cessation programs, vaccination schemes, and in-school public health education. A real-world example of this can be seen with pharmaceutical pricing in Ireland. Medicines represent a significant healthcare expense, and cost-effectiveness evaluations influence whether medicines are publicly funded. This is an example of how governments can reduce the cost of certain interventions for those who can normally not afford it. In Ireland, the free contraceptive scheme allows for cost reduction for individuals seeking contraceptives. Here, everything from initial consultations to the ongoing provision of contraceptives is completely free of charge for all those seeking it. Interventions like this are wonderful examples of how cost-effective strategies can be implemented and have an immense impact on public health outcomes. Economic incentives and health education in Ireland. Prevention can reduce long-term healthcare costs, and government funding influences public health campaigns. The government can invest in prevention strategies to hopefully reduce the financial burden on the public health system and also improve public health outcomes. In Ireland, this has happened in a variety of ways through schemes and programs such as the Healthy Ireland campaign, which aims to broadly tackle some major health risks such as poor diet and a lack of physical activity, targeted programs such as the Smoking Cessation Program from the Health Service Executive, which provides nicotine replacement therapy and consultations regarding smoking cessation, vaccination campaigns which take place generally in schools but as well as at general practitioners' office where vaccinations are free of charge, and screening programs for things like breast cancer and HPV that are also provided free of charge. In these cases, screenings and health education is used as a preventative measure that reduce those long-term health costs as well as preventing major illnesses from breaking out amongst individuals. An example of this is the smoking prevention and how that relates to economic incentives. Smoking creates major healthcare costs. In Ireland, tobacco taxation provides an economic incentive to reduce consumption. Here, taxation on tobacco products, namely cigarettes, is very high. The purpose of this is to incentivize individuals to stop smoking as a result of the cost associated with it. The idea is that funding supports prevention and cessation services. However, this can also sometimes highlight disparities as in older groups, generally we see smoking decline, and although that might be a result of external variables, it could also highlight a financial disparity amongst those older groups. And here is a graphic of that. So as we see, the amount of people who have quit smoking increase as age rises especially in men, but also slightly in women. And while this could be a result of, like I said, external variables, it could also highlight deeper health disparities. In conclusion, economics shapes healthcare availability, affordability, and priorities. Incentives can improve prevention, especially when implemented alongside other strategies, and effective health systems require balancing financial sustainability with equitable access, and this can be seen in Ireland through the schemes such as the Healthy Ireland campaigns, the vaccination programs, the screening programs, and the smoking cessation programs, which have all been made available free of charge and for anyone who needs those services.